Well, good afternoon. I said to you last week that our government was in the final stages of developing a plan to safely reopen Ontario. I said this plan would stand the test of time. This plan is designed to bring certainty and predictability to what our response to the pandemic will look like in the coming months. We've worked side by side with the Chief Medical Officer of Health, our medical health professionals, to put in place a plan that will lead us through the winter and out of this pandemic. Today, we're sharing with all Ontarians what they can expect over the next several months. I'll ask Minister Elliott to speak to the details shortly, but I want to highlight a few key principles that guide this plan. To begin with, we're sticking with what's worked for our province. This is a cautious plan. It slowly lifts public health measures over time, allowing us to monitor any impacts on our hospitals and in our communities. It provides Ontarians and businesses with the certainty they need to make the plans of their own. It will do everything possible to avoid broad lockdowns while enabling a tailored and localized response should we need to act. And it provides a clear end state for when remaining public health measures will be lifted, including when proof of vaccination will no longer be mandatory. While necessary to control the spread of COVID-19, the public health measures in place, including vaccine certificates, these are extraordinary measures. We said we would keep them in place we would not keep them in place one day longer than necessary. We said we'd remove them as soon as it's safe to do so. My friends, that's what this plan does. With the next step of measures easing on Monday, October 25th, when we lift capacity limits and distancing requirements for restaurants, gyms, and casinos, where proof of vaccination is required. I'd like to take a moment to acknowledge why we're in the position to confidently make these plans. It's because our health indicators show that we're on the right path. We are here because we stayed cautious, we stayed disciplined, and we never underestimated this virus. We look to other countries, other provinces. There can be no question that this was and is the right approach. We always put the health and safety of Ontarians first and focused on delivering one of the most successful vaccine rollouts anywhere in the entire world. And because of that, because of the hard work and the selflessness of Ontarians, we can see the end of this pandemic in sight. But it's not over yet. We can't get too comfortable or let our guard down. But we're going to be able to begin getting back to the lives we want. This shows how far we've come by working together and protecting each other. And there's a really important point I want to highlight. One that should drive home just how well Ontarians have done in battling the virus, and that it is the ICU capacity in our hospitals. We made clear that all the measures that were in place, all the restrictions, they were intended to protect our hospitals, and that our #1 priority was to fortify the hospitals and increase our ICU capacity. Today, I can say that we've achieved this. Our ICUs are strong with under 150 cases, as we added thousands of new critical care and hospital beds. That's why we have the capacity necessary to support other provinces who are struggling and need our help. We should all be very proud of how far we've come and know that it's because you all worked together. You supported each other and you rolled up your sleeves to get the vaccines that provides everyone with a maximum amount of protection. Now I'm going to hand it to Minister Elliott to walk us through the details. But I need to say again, she continues to be an absolute all-star as the Minister of Health. She and her team work nonstop around the clock, and I'm very grateful to the Minister. I will now pass it to Minister Elliott. Thank you, and God bless the people of Ontario.
Thank you very much, Premier. Good afternoon, everyone. Since the onset of the COVID-19 pandemic, our government has taken a cautious approach to reopening to protect the health and safety of Ontarians. And as the Premier said, we've made significant progress in our fight against COVID-19 thanks to our gradual approach and the efforts of millions of Ontarians. Through our plan to safely reopen Ontario and manage COVID-19 for the long term, we will replicate our earlier success by slowly and incrementally lifting all remaining public health and workplace safety measures by March 2022. And this approach will continue to be guided, as it always has, by the ongoing assessment of key indicators, such as potential new COVID-19 variants, increase in hospitalization and ICU capacity, and rapid increases in transmission. This cautious and gradual approach will prevent widespread closures, protect our health system capacity, keep our schools open, and support Ontario's economic recovery. As a next step, based on the continued improvements to key public health and healthcare indicators, effective October 25th at 12:01 a.m., Ontario will lift capacity limits in the vast majority of settings where proof of vaccination is required, including in restaurants, bars, gyms, and indoor meeting and event spaces. At the same time, other settings will be permitted to lift capacity limits if they choose to opt in to require proof of vaccination. This includes settings like personal care services, such as barbershops and salons, and the indoor areas of amusement parks, museums, and galleries. However, proof of vaccination will not be required in settings where people receive medical care, food from grocery stores, or basic medical supplies. At no time will people be denied these services based on their vaccination status. We will continue to monitor the effect of these capacity limits being lifted to evaluate the impact to key public health and health system indicators, particularly over the winter holidays and as students return to school. And in the absence of concerning trends in public health and healthcare, we will continue to cautiously and gradually lift other public health measures in November 2021 and January, February, and March 2022. Notably, if the situation is not deteriorating and in the absence of concerning trends, on January 17, 2022, there would begin a gradual lifting of vaccine certification requirements, Chief Medical Officer of Health directives, and capacity limits in settings where proof of vaccination is not required. Other public health and workplace safety measures, including masking, would remain until March 28, 2022, at which time they will be lifted. We know this is encouraging news for Ontarians who have sacrificed so much over the last 20 months. But we need to remain vigilant. Over the last week, more than 4.8 million Ontarians have downloaded their enhanced vaccine certificate with official QR code. There are also 979,000 people using the Verify Ontario app. Thank you to Minister Rasheed and your incredible team for helping to develop these tools. So if you haven't already done so, I encourage you to download yours today and take advantage of this easier and more convenient option to show your proof of vaccination. Today is a milestone in our fight against COVID-19. We have a plan to safely manage this virus in the long term and protect the health and well-being of Ontarians while ensuring Ontario remains open and recovering. Thank you all, and now I will pass it over to Dr. Moore.
Thank you, Premier and Minister Elliott. Good afternoon, everyone. Throughout the COVID-19 pandemic, the province has been guided by science and evidence when making decisions on how to keep Ontarians healthy and safe. And Ontario's strong COVID-19 vaccination rates and extensive public health measures have had and continue to have an impact. The trends in public health and healthcare indicators remain stable or improving, and the province is currently trending toward the best case scenario projected by the Ontario COVID-19 Science Advisory Table. Ontario's weekly case rate continues to decrease, and we are reporting one of the lowest weekly case incidence rates in the country, well below the national average. And while we never wish to see anyone admitted to an intensive care unit, the rate of COVID-19 ICU admissions remains stable. The province vaccination rate continues to climb, with 87.7% of eligible Ontarians with 1 dose of COVID-19 vaccine and 83.6% with 2 doses. I want to take this opportunity to acknowledge Ontarians for their commitment to limiting the spread of COVID-19 by getting vaccinated and following the public health measures. You are protecting yourself, your family, and your community through your actions, and I want to offer my sincere thanks and gratitude to you all. Because of your collective efforts, our schools remain safe, places to learn, and our businesses are safe and open. And because of you, the province is now in a position to implement a plan to continue the safe reopening of Ontario by gradually lifting remaining public health and workplace safety measures over the next several months. While we are optimistic about the future, the province will continue to monitor this situation very closely, and we will respond quickly to protect Ontarians' health, should the need arise. To manage COVID-19 over the long term, local and regional responses will be implemented based on local context and conditions. Public health measures would be applied provincially in exceptional circumstances, such as when the province's healthcare system capacity is at risk of becoming overwhelmed, or if a vaccine-resistant COVID-19 variant is ever identified in the province. And as these measures are gradually lifted, we must stay vigilant, as we do not want to cause any more disruption to people's lives. As we move ahead with reopening our province, Ontarians must remember that we need to continue to follow public health measures, such as washing our hands, wearing a face covering, and physical distancing, and to help ensure a safe reopening for everyone. It's also important that we continue the critical work to vaccinate those who have not yet received their shots. Vaccination saves lives, helps keep people from severe outcomes, including hospitalization and death. Vaccination continues to be the key to getting us out of this pandemic, so I ask that anyone who is not fully vaccinated to please protect yourself, your family, and your community, and get your shot as soon as possible. We want to continue to keep moving forward, never backward, with more closures and lockdowns. Thank you.
We'll take questions at the mic. If the journalists in the room could just form a line behind me. And just a reminder, it's 1 question, 1 follow-up.
Hi, Sean Leathong, CTV News. This question is actually for Dr. Moore.
Yep.
As we enter the colder months, Dr. Moore, if cases were to turn around, if things were to become worse, we'd heard Dr. Isaac Bogosh say today that when ICUs start filling up, it's already too late. What is the indicator you're actually going to use if things have to turn around? Is it ICU capacity or is it case count?
ICU capacity is one of the most important markers that we have. It is the finite capacity within the province, although we've done significant work to try to increase that capacity. So we'll be watching those at a regional level especially. We've built increased capacity across the province. We've got a very good system now to respond to local rises in cases. We've got regional programs in place to work with our local medical officers of health, both within a health unit and at a regional level. And then if it begins to spread regionally to higher levels within the province, we also have plans in place. So those are the key metrics, hospital utilization and the intensive care capacity.
My next question is about the opt-in strategy. That'd be for Dr. Moore, perhaps Minister Elliott. Is there a system in place where businesses can actually inform the government that they're opting in, or how does it work?
So opting in will be at a local level, that they have to put signage in place if they're opting in to the immunization certification process. If they want to do it for an event and or for a 24-hour period, that would be signage, public disclosure, and then that would be enforced by the local bylaws or public health agency as needed, and to ensure that they're compliant with the certification process.
Hi there, Richard Southern with City News 680. Premier, when you talk about hopefully lifting the mask mandate by the 28th of March, will that include schools, and are you confident that it'll be safe to do that? Are you confident that students will be able to be vaccinated by then, sir?
Well, March is a little ways off. We'd have to look at the numbers. I'd always consult with the Chief Medical Officer of Health, consult with the frontline education folks and the Minister of Education, and then we'll determine it from there. But I think we'll see what happens.
On another matter, sir, there's a big impasse between your government and the optometrists. A lot of seniors can't get their eye test done. They don't want to return to the bargaining table until they get what they think they're owed. Your health minister has spoken recently about this, but I'm wondering, sir, will you intervene in this? Will you do anything to get this situation fixed?
Well, first of all, I have all the confidence in the world in the negotiating skills of the Minister of Health, and before I pass it over to the Minister, you know, in government, we've negotiated a lot of deals, and you can't negotiate when someone doesn't come to the table. And, you know, we showed good faith. I think it was $39 million we gave them, but you can't negotiate by yourself. So I encourage them, please come to the table. Let's get a deal done. As Premier, I'm asking you, please come to the table. You know, the only people you're hurting are the people of Ontario. So I want a deal done. I have all the confidence in the world in the Minister of Health, and I know we're going to get a deal done, but we can't do it by ourselves. I'll pass it over to the Minister.
Well, we are certainly very anxious to resume negotiations with the Ontario Association of Optometrists. We have already paid $39 million into their accounts to cover the increases that they would have got based on physician increases from the period when their last agreement ran out in 2011 until today. But there are future increases. We've offered an 8.48% increase going forward, retroactive to April 1st of this year. And we also want to understand the overhead issues that the optometrists are concerned about. But we can't resume mediations with only one party at the table. So we urge the optometrists to come back to the table. We want to speak with them. We want to come to a solution that is going to be satisfactory to them and, of course, satisfactory to the taxpayers of Ontario, because we have a responsibility to be sound financial guardians of taxpayers' money. And so we want to start those discussions. We are continuing to fund those OHIP-funded services for young people and seniors over age 65. We are anxious to continue to do so, and they want optometrists to continue providing those services. So we ask the optometrists, the association, to please come back to the table so we can reach an agreement as quickly as possible. Thank you.
Matthew Bingley from Global News. Just on the vaccine certificates, you begin to roll them back in the dead of winter. Science experts are saying that you should probably wait until spring because that's the highest risk time. So I'm just wondering what the rationale is for rolling it back when everybody's inside and it appears to be higher risk.
Well, the numbers seem stable, and like we said, I want to be cautious, very cautious moving forward. We're one of the most cautious provinces in the whole province. Matter of fact, one of the most cautious in North America. But in saying that, if the numbers are stable, and before I'm going to pass this to Dr. Williams, but if the numbers are stable, this isn't a one-way street, by the way. It's a two-way street. A one-way street, we just can't keep going down and down when the numbers are low, and we have approximately 400 and change in cases and ICUs that are 150. We have the capacity. It has to be a two-way street. You know, there has to be benefits to the people across Ontario to see all the hard work that they've done, and they're able to see the difference. But let me reinforce the word cautious. We have always been cautious. I'm going to be super cautious. If we do not see the numbers in a stable place, we just aren't going to do it. It's as simple as that. But I'll pass it to Dr. Moore.
That's an excellent question, and thank you for it, because as we get into the colder months, this virus does want to spread. As the humidity inside goes down, the virus wants to spread. It's a call for more people to be immunized to decrease the overall risk to our population heading into the winter. We don't want to see more people in the intensive care unit. The good date that we've set, which I think is absolutely appropriate, is January 17th to review the data. That will give us an opportunity to review the preceding coming 2 months of potential activity within Ontario. It'll let us get through the holiday season and analyze if there's been any spread within social settings or in other workplace settings to make an informed decision. So the Premier absolutely is correct. We will be following the data. We'll be analyzing it very closely heading into January 17th to make a decision whether we move forward. And as we've seen through step 3 of the reopening, we took our time, we were cautious, and I think that has saved lives, and we'll do the same again and again to protect the health of Ontarians.
Dr. Moore, if I could just follow up with you. The March date next year for masking potentially to be lifted, what is it about that date that, you know, from this point that you can confidently say that you can lift masking regulations based on, you know, what we're seeing with the UK right now, what you note, the science table noted with Nordic countries when they withdraw them? What is it about March?
By March, we hope we've maximized our immunization strategy in Ontario, that we have more Ontarians immunized to the point that this virus doesn't have a host in which it can reproduce. We'll have our 3rd dose strategies will be completed. Our immunization strategy for children from 5 to 11 will have been completed, and we'll have a very good point to be able to look at the data, to review a safe opening for all of Ontario, and then we will have to learn to live with this virus. But it gives us a significant amount of time to build up the immunization protection of our population. And sadly, some will acquire immunity naturally, but our goal is to continue to maximize our immunization strategy during this time. We're not stopping. The last mile strategy is continuing to further protect Ontarians. And then as we go outside, the risk does decrease. We've seen that naturally after every respiratory virus season, including after COVID-19. The risk does decrease. And we do hope, as we continue the high immunization rates, that we can have a great spring and summer and fall following in 2022.
Harrison Lohman, TVO. Hi. Question for the Premier here. Premier, the federal Liberal Employment Minister, Carla Qualtrough, said yesterday, I believe, that it's likely that people who will lose their jobs for not complying with employer vaccine policies will not be eligible for employment insurance, EI. I'm wondering if you agree with that or what you make of that.
Well, that's up to the federal government, but you know something, my heart breaks for everyone across the province has seen the challenges, and let's make no mistake about it. Folks, just get vaccinated. That's what it comes down to, and that's what I'm trying to push. I don't want anyone to lose their job. I really don't. It really bothers me. But in saying that, the priority is to make sure that they get vaccinated. The reason we're able to move forward is because people went out and got vaccinated, and hopefully another week or close to it, we'll hit our 90% target on the first doses, and shortly thereafter the second doses. But folks, just get vaccinated.
Mr. Premier, the next election is scheduled for June 2nd, 2022.
Yes.
You've denied claims in the past that you'd call an early election before that date, and I'm wondering today if you will commit that the next Ontario election will in fact take place on June 2nd, 2022.
I will commit. The next election is June 2nd.
Thank you.
Thank you.
Hi, Premier. Adrian Gobriel with City News.
Hi, Adrian.
You just mentioned, how important it is to continue to encourage people to get vaccinated. Yep. Though you've just given those who are not vaccinated a finish line, an end date, as to when they'll be able to start to go back into restaurants and not have to show their proof of vaccination. Do you think that's counterproductive considering the measures and the steps that you're trying to take?
I don't think so, because we still have a couple months left, and we're seeing vaccinations every single day, even first doses. What I really like is the first thing when they send it to me every single day, I look at the first doses, and we still see 6,000, 7,000 first doses coming on board. So people are coming on board, and I'm just hoping that if we continue over the next couple of months, well, we will be over 90% by then. Just keep getting vaccinated. That's what, but we can't forever. To the end of time, just ignore the people that aren't vaccinated. They're part of Ontario. Again, I'll be up here preaching every single day to get vaccinated, but there has to be a time that everyone eventually comes together and our vaccination rate is high enough and our ICUs are in good shape. So that's going to be the determining factor.
On the anti-vax front, I've spent the last couple of days following independent MPP, Mr. Hillier, who has been posting photos of individuals on his social media who've recently passed and claiming that they died due to the COVID-19 vaccine. Multiple families of these deceased individuals have spoken out, saying that's untrue, that's my loved one. They say they're being further traumatized. They're wondering what kind of recourse they might have. Do you believe that an elected official can continue to perpetuate misinformation, share misinformation, and hurt Ontarians? And what can be done, if anything?
I think it's appalling an elected official would do that, put someone who's passed away for another reason and post it and say it's because they had vaccinations. It's disgusting, in my opinion. That's the reason Randy Hillier is not part of our party. That's the reason Randy Hillier will not win the next election if he decides to run. And ironically, Randy Hillier's riding is the highest vaccinated riding anywhere in Ontario. So they don't believe in him either. I think this guy, I always said before, the cheese slipped off the cracker with this guy. He's gone rogue. The guy's lost his mind, in my opinion. And I ignore him. I think it's ridiculous. I wouldn't even give him the time of day if I were the media. That's what he loves.
Hi, Premier Jeff Gray, Globe and Mail.
Hi,
How
Jeff.
are you?
Good. How are you?
I wanted to ask you about the restaurant business.
Sure.
I hadn't heard the sort of level of anger from business lobbyists over that time after the rules were loosened for the hockey rinks and so on in years.
Mm-hmm.
Are you contemplating any moves to repair that relationship? This is small business, these should be natural constituents for you and your party.
Yeah, so when it goes to the OHL, the small little urban hockey teams, or the NHL, I always consulted with their chief medical officer of health. And being in a large arena with the airflow a lot better, I was told we had consensus, we moved on it. Now, it's only been about a week or 2 weeks, that now we're opening up the restaurants. I have supported the restaurants. My heart bleeds for these small business owners. We support them to a tune of $4 billion, and I'll always support them. But this is why we need people vaccinated. We need to get it moving forward, and I'll always be there to support them. And I apologize for, if it's been 2 weeks and we didn't line them up side by side. But again, I always consult with the chief medical officer. He gave us the green light, and maybe, I won't even ask him to come up. That's what happened. He said move forward, we move forward, and now we're going to move forward with the restaurants.
This will be the last question.
Well, and I think that's what the restaurants are saying. I mean, I think you're right. It was a symbolic thing that they have hurt for so long through this whole thing, unlike maybe any other business.
Yeah.
And now with patio season ending, a lot of them are hanging on by their fingernails, they tell me. One thing they've asked for years is for the province of Ontario to cut the cost that they pay through the LCBO system for their liquor. They pay way more than any other jurisdiction. Mm-hmm. Is that something that's on the table, that's on your radar, that you might offer them as a way to get this business back in
So
back
we're
in shape?
looking at that, and I just want to remind you, we're only a government that allowed them to do this. So we're going to keep that moving forward. We're going to come up with any idea we possibly can to support these restaurants. I'm a big believer in small businesses and entrepreneurs, and we're looking at that. But I just want to remind you, there's a support that we gave them, plus their opportunity to sell a bottle of wine or a bottle of liquor. I think it's really helped them. So that's what I believe we're going to be doing, is continue to support them and allow them to sell their alcohol. But before I finish, I just want to say that next week is Respiratory Therapy Week, and these are some of the absolute heroes on the front lines of our pandemic response, and I want to recognize them for everything they've done. So a huge thank you to our world-class, and I say world-class, respiratory therapists for everything they've done for us. We're very, very grateful. Folks, I thank you. We're moving in the right direction, not because of me, not because of our government, because each and every one of you. I'm very, very grateful. So thanks, everyone, and have a very safe weekend. All the best.
Thanks, everyone.